Today I'm going to be recording a history and physical for a 66-year-old female, admission H&P on hospitalist service. The patient's chief complaint today was that her heart was racing and her chest hurt. She presented to the ER with complaints of racing heart and chest pain. An EKG was done in the emergency room that showed atrial fibrillation with rapid ventricular response. The patient was admitted to ICU and placed on a cardizem drip. She had an allergic reaction to the cardizem that was pretty minor, consisted of a decent rash and some itching. She was then placed on esmolol drip and converted into sinus rhythm during the night. She was placed on oral verapamil and weaned off the esmolol, and she remains in sinus rhythm and free of chest pain at this time. The patient's past medical history is significant for hypertension, hyperlipidemia, rheumatoid arthritis, intermittent AFib, breast cancer, and frequent UTI. The patient has had a colonoscopy in her surgical history, a left mastectomy with surgical debridement. Looks like she's had to have the debridement 4 times, but she's healed up. That was in, over a decade ago. She's had a right breast biopsy, which was benign. She's had a cryoablation for cervical dysplasia on Pap smear and C-section ×2. Her daily medications include aspirin 325 milligrams daily, atorvastatin 40 milligrams daily, folic acid 1 milligram daily, furosemide 40 milligrams daily, hydroxychloroquine 200 milligrams BID, letrozole 2.5 milligrams daily, meloxicam 15 milligrams daily, naproxen 500 milligrams TID as needed for pain, omeprazole 20 milligrams daily, sertraline 50 milligrams daily, lorazepam half a milligram 3 times a day as needed for anxiety, fluticasone nasal spray 2 sprays BID each nair, and triamcinolone ointment to apply to any sort of inflamed skin areas. We have listed cardizem as a new allergy. Her social history: she lives at home with her family. She and her spouse are currently raising their 3 small grandchildren. The patient denies smoking, alcohol abuse, or drug abuse of any kind. Her family history is pretty significant. Her father had hypertension. Her mother had high cholesterol and ovarian cancer. I talked with her because she has a strong cancer history in her family. She has family members that have had pancreatic cancer, lung cancer, colon cancer, and multiple cases ovarian and breast cancer. She does comply with her routine screenings for EGD, colonoscopy, and breast exam. She is up to date on her immunizations. Upon a review of system, the patient denies any pain or discharge from her eyes. She does wear reading glasses. She denies any hearing loss or pain, denies any sinus issues or nasal discharge. She denies any sore throat, pain, or difficulty swallowing. She denies any confusion or recent dizziness. Respiratory-wise, she does report some symptoms of shortness of breath with her chest pain that was previously described in the HPI. She denies COPD, cough, or current shortness of breath. She appears comfortable at this time. Denies any history of CHF, heart attack, or stroke. She does report the chest pain with the episode of AFib with RVR, and she reports the history of hypertension. She denies any constipation or diarrhea, denies any abdominal tenderness or pain. She denies any pain with urination or blood in the urine. She does report a history of frequent UTIs. She reports a history of rheumatoid arthritis with chronic pain. She denies a history of eczema, dermatitis, or acne. Upon physical exam, the patient is well developed. She's lying supine in the hospital bed. She's alert and oriented, very pleasant, and a very good historian. She denies any discomfort at this time. Her vital signs are as follows: temperature of 97.9 degrees Fahrenheit, blood pressure of 142/60, pulse 62, sinus rhythm, respiratory rate 17, and O2 saturation is 99% in room air. Her head appears normal with no noted malformations or trauma. Her facial expressions are symmetrical bilaterally. She is Perla with 3 millimeters bilaterally. Her eyes are free of redness or drainage. There's no exophthalmos noted. She has no apparent signs of hearing difficulty. Her ears appear normal and symmetrical bilaterally with no deformity. There's no nasal redness or drainage. Her neck is supple without swelling and no lymphadenopathy. No JVD is noted either. Her respiratory, she's got a regular rate and pattern. No dyspnea. Lungs are clear bilaterally and a little diminished to the basis, most likely due to body habit as she's slightly overweight. The patient is in sinus rhythm at this time. S1 and S2 are present without gallops or rubs. She does have a grade 2 of 6 systolic murmur. Her cap refill is less than 2 seconds bilaterally. A new echo was done today. It reports an ejection fraction of 62% with a mild tricuspid and mitral regurgitation. I did discuss that with the patient. She had a CT of the coronary arteries as well that showed no significant disease. She has no edema or swelling in her bilateral lower extremities. Bowel and bladder, her abdomen is large and soft. It's non-tender to palpation. She does have bowel sounds in all 4 quadrants. She is voiding without difficulty. She denies any nausea or vomiting. The patient has no kyphosis or scoliosis noted. She does complain of joint stiffness on a daily basis due to her rheumatoid arthritis and states that her anti-inflammatories are what work best for her. Neurologically, all cranial nerves are intact. Her grips are strong bilaterally. She's alert, oriented times, person, place, time, and purpose. And she's conversing appropriately. And like I've mentioned earlier, she's a good historian. Her lab and radiology was pretty insignificant. Her white blood cells, her H and H are all normal. Her glucose this morning was 98. Bun and creatinine are normal at 15 and 1. We've done serial troponins on her, which have all been negative, and her chest x-ray doesn't show any sign of pulmonary edema or pneumonia or anything like that. That's also negative. Diagnosis are as follows. AFib. She converted on Esmolol drip. She's now on a maintenance dose of verapamil 240 milligrams extended release daily. She's on bridge therapy for anticoagulation. Currently Lovenox 80 milligrams sub-Q every 12 hours and on daily Coumadin. Her last INR is 1.12 and the pharmacy is dosing that. Chest pain, that's resolved. She's had none since her heart rate has been controlled and her cardiac profile has been negative. Hypertension is resolved. She's no longer on any of her hypertensive meds at home, and she hasn't exhibited any signs of hypertension as an inpatient. She has hyperlipidemia. She's on her home Crestor, and she's got rheumatoid arthritis. She's also on her home medications, and we did restart her Mobic this morning. The treatment plan, we're going to consult case management to schedule outpatient sleep study to assess for obstructive sleep apnea. The husband states that she snores terribly. This could definitely be a precursor to her AFib exacerbation. We started the extended release verapamil today. We'll keep an eye on her heart rate, watch her one more night for sleep apnea, and monitor her heart rate in ICU. And she'll have to stay in ICU today because there's no open medical beds on the floor. And then we plan to send her home tomorrow morning. Thank you.